Hi everyone, so continuing in our conversation about different ways of documenting using different types of notes, today we're going to talk about BIRP notes. So this is really a structured way to document the client interactions, and these are going to parallel SOAP notes a little bit, but they are more designed to focus on behavioral health contexts. So BIRP stands for behavior, which is similar to the S and the O from the SOAP note. Intervention, which is going to be what you did, the response, which is going to be how the client reacted, and then the plan, which is similar to the P from the SOAP note that we talked about in the last lesson. So this slide just goes over and continues to go more into depth about what these different things are. So everything I just talked about, the S and O of SOAP is behavior, intervention, response, and plan. It helps us to capture observable behavior, and it also helps us to summarize the client's response, and then it's going to outline the next steps for the participant to engage successfully in an intervention. One of the key differences from the SOAP note is that the BIRP note combines the subjective and objective portions of the SOAP note, so the S and the O, into behavior, which is more streamlined for behavioral health and therapeutic interactions. So that's why that is a little bit broken down and concise. So methods used to reach goals and objectives of the therapy. This is going to be a concise summary of the conversation, which is going to focus strongly on the therapist's actions and the patient's reactions. So some session objectives that you might consider: what are the goals of the therapy? For example, if there's a problem, what is your professional understanding of the client's diagnosis, condition, and or challenges? You can document your session content, what happened during the session, what methods and techniques and approaches you used and or implemented. These are all things you're going to want to consider in your note. Below are some verbs to consider in your note when you're writing. So either encouraged, validated, reinforced, prompted. So any of these types of verbs are going to be really helpful when it comes to describing your documentation and documenting your intervention that you engaged in with your participant. So looking at the B, behavior. So again, this is what you observe and what the client reports. This is going to mirror the subjective and objective portions of the SOAP note. So I'm going to keep reiterating that just to help your brain focus on, that a lot of things are the same. So just going to help your brain think about a SOAP note versus a BIRP note, different aspects that are different and the same. So this is just an example. So met with a client X in the office. The most recent assessment shows they are presenting symptoms of anxiety. Today they showed signs of exhaustion, lack of focus, and they looked tired. They reported not being able to sleep in the past week and feeling overwhelmed by work. So again, this is going to be details about the session and where it took place. Interventions. So this is what you did during the session. So this really should probably be one of the easier sections because you know what you did. You know what you planned for your participant to do throughout your time with them. So this is the example through client-centered techniques, this writer, and that's often how you'll refer to yourself kind of in third person like that. You'll say this writer encouraged or the patient to expand their thoughts about their work. Negative thoughts were identified and challenged. The patient was asked to see if there was a link between their insomnia and the stressful period at work. The connection was successfully made and normalized through discussion. The conversation then focused on the specific work-related triggers that may have led to insomnia. A mild sleep aid was prescribed. So again, that's an example. Tips, again, for the intervention section: use the active verbs list. Be specific about the techniques and the approaches, and then again, you're always going to connect your interventions to the client's goals. So response. So this is when the therapist is going to record the client's response to the intervention. This is going to include what the client or patient said and how they reacted. So, however, they were. So the patient initially rejected the link between their insomnia and stress at work, then asked how work made them feel. The patient became silent, reduced eye contact, and disengaged from the conversation with the writer. After a few moments of thinking, the patient was able to describe their own feelings in relation to their work. So again, tips with that are to capture the emotional, cognitive, and behavioral responses of the particular patient that you're talking to. You're going to want to include the changes over the course of the session, and then you're going to want to keep the descriptions very objective. And finally, the P, plan. So this is going to outline when the next session will take place and its focus. You're going to look at the treatment plan, what elements need to be adapted, removed, or introduced, looking at next steps. So what are you going to do next? So in this example, the next appointment scheduled for September 16th will assess the client's response to the sleep aid and reassess their feelings about their work. So we're going to want to include frequency of follow-ups in the plan. You're also going to want to note the specific interventions that are going to be continued or added. So if you are changing something up a little bit for next time, making sure to include what that is. And then you're going to want to make sure that the plan is directly correlating to the goals and the assessments that you've previously done with that particular patient. So all important things to keep in mind. So for this next section, you're actually going to do that on your own after you've concluded watching this lecture. So the next slide contains a video clip, which is a SLP, which is a speech language pathologist, for those of you who might not know, playing with toys. So as you watch, you're just gonna jot down a few things, a few aspects that we talked about of the BIRP. So that's going to be for the B, what behaviors do you observe? For the I, what interventions are being used? The R, how does the child respond? And the video, P, what would be the next steps? And this is a really good opportunity to practice translating those interactions that you're going to watch real world wise into the clinical documentation aspect of writing a BIRP note. So here's the link right there. So at your leisure, when you're done with this lesson, you can go ahead and watch it and then think about those things. As always, here with any questions, comments, concerns, feel free to write anything on the discussion board that you may have questions about. And I look forward to hearing from you all soon. Thanks, everybody. Bye.